Hello friends, welcome to my new video. So today I'm back with a new video. Uh, here today's topic for discussion is on diplopia, and where I will discuss with you all about the causes of diplopia and what are the symptoms of diplopia, types and management options for that. So you need to wait a minute where I need to share my screen. Okay, just wait for a while. Yes. So I hope my screen is visible to all of you. So this is the presentation. Okay, fine. Okay, so let's start. So this is the presentation where the topic is ocular diplopia, understanding double vision. Okay, so let's start. Introduction. Where? So simply, diplopia is a visual disturbance which is characterized by the perception of double images, right? So here it is the separation of images in vertically, horizontally, or obliquely in this kind of directions, and it can be described as monocular and binocular diplopia as well. So this condition can be due to either ocular misalignment, which disappear when one eye is occluded, or to an optical problem, which is termed as monocular diplopia. Okay, so here this monocular diplopia doesn't go away even after you close one eye because it is monocular. Okay, so these are the types of diplopia where diplopia is two types, monocular diplopia and binocular diplopia. So we will first start on monocular diplopia. So let me put the laser pointer. Yes, so this is the monocular diplopia and binocular diplopia. So first of all, we will start with monocular diplopia and then we will go to the binocular diplopia. Okay. So we will have a very detailed discussion on these two types. So let's start. So monocular diplopia. So here simply monocular diplopia occur when double vision persists even after one eye is occluded. So the causes of monocular diplopia are as follows like refractive error, like astigmatism, irregular curvature of the cornea of the lens. It can also lead to diplopia in one eye. Or uncorrected presbyopic patient can also give you the complaint that they see double vision something. Okay. Or if I say about the corneal conditions like keratoconus, this also can lead to irregular thinning and also very much high cylindrical number in one eye, and that is leading to multiple focusing point, and that can lead to monocular diplopia in that eye. Okay. Another is immature senile cataract. So this is the lens issues related monocular diplopia, where because of the immature senile cataract, where you know that lens nucleus is having more refractive index than the lens cortex area, right? So when the immature cataract start developing, then the refractive index of this nucleus getting more higher. Because of that, the light rays which is passing through this area is getting focused very much earlier or in the front. And then the light rays which is going through this area, and that is leading to two focusing point, and that also can lead to monocular diplopia in that eye. Okay. And another is like this is cystoid macular edema, or this is macular edema or macular involvement. All these things can lead to hyperopic shift of the patient, where one eye is suppose normal, it is normal macula, everything is normal, and another is having CME, and that can lead to more diplopia conditions because of distorted image and such conditions. Okay. Or diplopia can also be due to tear film problem, like in case of dry eye, because of the tear film instability or unhealthy tear film, there is no regular reflection of the light rays, and because of the irregular reflection happening because of the tear abnormality, that also can lead to shadowing problem or diplopic condition. Patient will give you the complaints. Or yes, this is the pterygium formation. So growth of the conjunctival tissue over the cornea, which is known as pterygium, and because of that pterygium, there is a irregular focusing point of the light can happen, and that can lead to pterygium diplopia. But diplopia will happen in pterygium only in case of pterygium grade 3, but where in the pterygium grade 1 or grade 2, where pterygium is only limited to this area, where pupil is not involved, then the patient may not give you the complaint of diplopia. But once the patient pterygium is covering the visual axis, he might give you the complaint of monocular diplopia and that eye which is having pterygium. So here the surgical excision can be the option to give the patient relief from that, right? And let's discuss about the binocular diplopia causes. So binocular diplopia occur when double vision disappear um, if one eye is occluded. So the causes are typically related to misalignment or issues with the muscles, nerve, or brain that control both eyes. So it just if there is an imbalance in these things, that can lead to binocular diplopia. So let's start from strabismus, where you can see that this lady is having strabismus, esotropia in the left eye. So esotropia, inward turning of the eye, or exotropia, outward turning of the eye, hypertropia, hypotropia, anything. Because of the eye misalignment, there is two here in this eye, images are forming on the macula, but here the images are forming on the parafoveal area. So because of that, the patient might give you the complaint of diplopia, where if you occlude this eye, then patient will not give you the complaint of diplopia then. Okay, so that is binocular diplopia. Or nerve pulses like cranial third nerve pulse or cranial fourth nerve pulse. Third nerve pulse, it lead to a restriction of the eye movement, as well as pupillary involvement can also be there, because third nerve is controlling also nerves. Maximum nerves are controlled by third cranial nerve or oculomotor nerve. And also cranial nerve 4 pulse or trochlear nerve pulse can also lead to issues with downward eye movement. Or cranial nerve 6 pulse can also lead to lateral movement of the eye, and this thing can also lead to diplopia condition. So that's why you need to look at very nicely. Another thing like neurological conditions like multiple sclerosis, where in my previous videos on papilloedema or optic neuritis, I discussed about the multiple sclerosis condition, where I told you about it is a demyelinating effect which is affecting the optic nerve. So because of the demyelination, if optic nerve is getting involved, then the patient might give with a complaint of diplopia or stroke or brain tumor. So because of the brain tumor, in case of papilloedema cases also, I also discussed about the formation of tumor or cyst inside the brain. So because of this cyst present or brain tumor, it gives the pressure on the nerve which is controlling the eye movement. So that also can lead to diplopia. So all these things you need to keep in mind. So this is the Graves' disease. So Graves' disease is because of hyperthyroidism. And because of the Graves' disease, there is a restriction of the eye movement. Okay, so this restriction of the eye movement is happen, and because of that, the patient might give the complaint of diplopia. So you need to keep in mind with this also. Another conditions like myasthenia gravis, it is an autoimmune disorder which is causing muscle weakness. That also can lead to weakened eye muscles, or trauma to the eye or trauma to the orbit can also lead to eye misalignment, and that can also lead to binocular diplopia. Or infections like orbital cellulitis can also lead to diplopia conditions. So these are the binocular diplopia I discussed with you all. So I have covered the monocular diplopia and binocular diplopia causes. So now we need to move to symptoms. Symptoms means what are those symptoms that you will observe in the patient who is having diplopia. First of all, we will discuss on monocular diplopia symptoms, then we will go to the binocular diplopia symptoms. Okay, so monocular diplopia persists when one eye is closed, and the symptoms are usually related to issues within the affected eye only. So here the double vision of one eye, here the seeing two images of a single object with one eye open, or blurry vision or ghosting, all such conditions the patient will give you the complaint. Also, the patient give you the complaints like distorted visions or glare issues or he will also give the complaints like he's facing difficulty to focus, and all such symptoms the patient will give you in case of monocular diplopia. So if I tell you with the binocular diplopia, so first of all, diplopia disappear when one eye is occluded. So the symptoms are due to misalignment of the eye or issues with the muscles or nerve that I already told you, right? So here the binocular diplopia, the double vision in both eye. Here the patient is seeing two separate images of a single object when both eyes are open. Okay, so here it can be due to misalignment of the eye or strabismus. So here you can see that this person is having normal orthotropic in this eye, ortho, but here in the left eye, it is esotropia. So because of that, the patient is having misalignment or strabismus, and that is leading to diplopia in this patient. So here, this is the we can see noticeable inward turning of the eye, right? Or else the patient will also give you the complaints of headache because of the diplopia, and also they will most of the time prefer to occlude one eye and see only through one eye. In case of binocular diplopia, that is also one symptoms that you will see. Another thing is like they most of the time prefer to tilt their head to see any object. So there is also one sign that they are having diplopia. So to correct it, they need to tilt their head. So that is also one symptom. So here, abnormal head posture is also alarming sign. Okay. And another thing, like this is because of the neurological symptoms, like because of hyperthyroidism, as I told you earlier about the Graves' disease. So it is all leading to restriction of the eye movement that also can lead to diplopia conditions where the eye tend to move outward. So here you need to measure the outward proptosis by help of arterial exophthalmometry, right? This is thyroid eye disease because of this thing. It is happening. And another is like if I told you about the trauma or where swelling you will see in the patient eye or pain, redness, all such things are also can be an alarming thing that patient might have diplopia. Okay. So here another thing like when to go for the emergency medical advice that suppose suddenly you got the diplopia. So sudden onset of diplopia like immediate medical attention is very much necessary as it can indicate serious conditions like stroke or aneurysm. So that is why you should go emergency health examination, eye examination. And second is the accompanying neurological symptoms, like if double vision is associated with other symptoms like muscle weakness or difficulty speaking or facial dropping, then also you know to go for eye examination in an emergency manner. Persistent diplopia, where continuous or worsening double vision should be evaluated by an eye care professional. So that's why if you are experiencing this thing, then you have to go for an eye examination. And lastly, pain and redness. So here indicate an infection, inflammation inside your eye. So that is why you have to go for the medical advice as soon as possible. Right. So let's go to the treatments. So what are those treatment options? First of all, glasses. Why? To correct the refractive errors such as myopia, hypermetropy, astigmatism, which can cause monocular diplopia. So here, after putting the lenses in the glasses, it will adjust the focusing point so that the right light rays enter the eye correctly and helping to form a single clear image on the retina, and that can erase the diplopia symptoms. Here, the single vision lenses for general use, but bifocal and multifocal lenses can also be given for the presbyopia if the presbyopic patient is also giving the complaints of diplopia. So here, glasses can be given. Contact lenses, right? The purpose to correct the refractive error similar to glasses, contact lenses sit directly over the eye surface, providing wide field of vision and often better visual acuity for certain conditions. So here in contact lenses, suppose the case is an anisometropia, where there is a wide difference of refractive error. Suppose one eye is -6, another is -1. Difference is very high. If you give glasses, the patient will not be comfortable. But in contact lenses, you can give the full correction. Even after that, the patient is very much satisfied. So in such conditions, you have to give the patient for go for the contact lenses. So here there is several types of contact lenses like soft contact lenses, rigid or gas permeable contact lenses. Depending on what is the amount of cylinder is there, you have to select, right? Now another is this is the prism lenses. So first of all, the purpose is to align the images seen by each eye, thus reducing or eliminating double vision in binocular diplopia. Here, prism actually bend light before it enters the eye, so helping to merge the two image into one eye. So this is the Fresnel prism is put in these glasses. So here it is also very much working condition. Another is like this is frosted glasses. Suppose the patient is having diplopia, binocular diplopia, and it is not correcting. So this is why you given the patient a frosted glasses or eye patch in one eye, and patient is allowed to see with the other eye where diplopia is erased. So this is what you can do, or even patching therapy is given for the amblyopic patient as well, right? And surgical options are also available where strabismus surgery can also be performed. If diplopia is because of the strabismus, then first of all, if it is not corrected with glasses, go for the surgery, and then you can go for the vision therapy and such conditions, and maybe it can reduce the diplopia condition. If the diplopia is because of the immature canal cataract and such conditions, then cataract surgery is advisable to remove the cloudy lenses that is causing the monocular diplopia. And the surgeon will remove the cloudy lens and replace it with a clear artificial intraocular lens. So that can also be done. So this can be happen. And if there is a presence of refractive error, and if the patient don't want glasses or contact lenses, then refractive surgery can also be one option where you can advise the patient for LASIK, PRK, or anything that is available in your hospital. So these are few tips, and another is like to correct the diplopia conditions. Eye exercises, vision therapy, orthoptic therapy also work a bit well, right? So that's all, friends. Thanks for watching. Please don't forget to like my video and subscribe to my channel. I hope this video helped you a lot in understanding something more about diplopia. So I will surely come very soon with a new video on a new topic. Okay, thank you so much.